it's Janae with Daily Dental Hygiene, and today I'm going to be talking about dry mouth. What is dry mouth? What causes it? And what are some products and relief that we can get with dry mouth? So first off, dry mouth is a lack of salivary flow. It's a lack of saliva in our mouth, and it can lead to discomfort talking, chewing, breathing, just in general. People wake up with extreme dry mouth in the middle of the night, totally uncomfortable. So now that we know what dry mouth is, let's explain why it is caused. So dry mouth can be due to medications, stress, hormones. A lot of times I see it with patients going through chemo and radiation, since the salivary glands are highly affected from chemo and radiation. And it can be something that you can change. So you can change your medications. For example, Adderall causes extreme dry mouth, and it's from, your adrenaline, kind of kicking up, which can cause dry mouth. Stress, oh my gosh, when you're stressed out, your salivary flow goes away. So some of these things that we can change, some of the things like chemo and radiation, we can't change, but there are absolutely products that we can do to, help out. So why is saliva even important? Why is this even a topic I'm bringing up? Saliva has calcium phosphate and fluoride in it. These are naturally occurring minerals in our saliva, and they coat our teeth all day long. So while that bacteria is trying to cause cavities and trying to pull the minerals from our teeth, our saliva coats our teeth and allows for, the remineralization of our enamel and the protection against cavities. So people that have a drier mouth actually have a big increase in cavities. Another thing is that your saliva is like a natural power wash and hose system. It's flushing off the bacteria and the food from our teeth. Elderly populations usually have a lot of soft plaque and food stuck in their teeth, and it's because they generally have a very low salivary flow from age, chemo radiation, definitely from medications and things like that. So not having enough saliva can definitely cause a detriment to our mouth. So let's talk about products that are really great that will allow our mouth to stay lubricated to protect against all these things. So one thing I like to do to increase salivary flow is chewing gum. Now, the gum that I love, the gum of choice for me is Trident gum. Trident gum has an ingredient called xylitol. Xylitol is a fake sugar that when it's ingested by bacteria actually kills bacteria in the mouth. It's a very anti-cavity product. So you can get xylitol mints, xylitol gummies, xylitol lozenges, xylitol lollipops. Trident gum, in like regular Trident gum at the store, has xylitol in it. You can go on Amazon and find lots of products. They're great. You can give them to your kids, to whoever, and they taste great. They taste like candy, and they are extremely anti-cavity. Another product that I want to bring up is Biotene. Biotene is very commonly found in any store. It's a mouth rinse, and it's like, think about it like eye drops for your eyes that make it so that your contacts or your eyes don't dry out. Biotene mouth rinse, it's a white bottle with a blue lettering on it. It coats the mouth like lubrication eye drops do for your eyes and protects up to 4 hours. So what you do is you swish around with it for 30 seconds, spit it into the sink, and don't rinse your mouth out after, and it will kind of keep your mouth lubricated and nice and, moist for the next 4 hours. They even have sprays. Go on Amazon, type in dry mouth sprays. You can check out all the reviews. There's organic, holistic, whatever you are into. There are nice, easy sprays. Like you can put a spray for your eyes. They have a spray for your mouth. You can keep them in your purse. You can keep them next to you on your nightstand. At work, sometimes it's hard. You wake up in the middle of the night, you don't want to use Biotene, or you're, driving, or you're at work. It's not accessible to use a mouth rinse. So you can definitely use a spray to keep your mouth moist. Chew gum, chew mints, chew lozenges that have xylitol in it. Use a spray, use the Biotene. Make sure you are not substituting dry mouth with things that have sugar in them, like candies and lollipops, things to stimulate salivary flow, you're gonna get a lot of cavities unless it's a fake sugar like sorbitol or Splenda, stevia, aspirin, like all these other fake sugars that we like put in our coffee. If it's real sugar in it and it has, you know, when you look on the ingredients, there's a sugar content. If it doesn't say 0 and the sugar ingredient doesn't have a fake sugar in it, you're gonna cause a lot of cavities to your mouth. So with a lack of salivary flow and now you're chewing things that have a lot of sugar in them, huge increase for cavities. So please try those products. I know sometimes it's frustrating when you find a medication that works for you and your medical reasons. So I would never, without your doctor having a conversation, recommend like getting off of, you know, your high blood pressure medication. You might switch a different dosage. You might try maybe a different type of high blood pressure medication, but just know that I know that it can be frustrating when you find something that works for you and now you have this dry mouth as an after effect. Dry mouth is one of the most common side effects of most medications, and I've experienced myself. So I get that you can't always change your medications. I really care about your health and things like your blood pressure, your cholesterol, or your diabetes meds. Don't change those. Try these other products and these other tips and tricks to kind of relieve some of the symptoms of dry mouth. And drink lots of water throughout the day. Do not drink sugary drinks at all. Make sure that everything is water or, you know, like a vitamin water or an ice water that has, you know, 0 calorie, sugar, carbs, all of that. It's a 0, all natural. Those are some great ways to keep your mouth hydrated. Take care, guys, and have a great day.